Anal cancer and rectal cancer are very different cancers. These areas are both part of the lower GI tract. We think of the lower GI tract as being comprised of the colon, the rectum, which is the lowest 12 to 15 centimeters of the colon, and then the anus, which is the opening between the rectum and the outside of the body. Colon cancer and rectal cancer are most commonly adenocarcinoma, which is a cancer that arises from gland cells that line the majority of the GI tract. Anal cancer, on the other hand, is very different. When a patient develops an anal cancer, it's most commonly a type of cancer called a squamous cell carcinoma, which looks and behaves very differently than an adenocarcinoma of the rectum. Most commonly, anal cancer patients will present with symptoms. They may have bleeding from the anus, they may have pain, they may feel a growth in the anal region. Rectal cancers may be picked up on colonoscopy. Other times, patients will present with symptoms, most commonly bleeding from the rectum. So the treatment for rectal cancer and anal cancer is very different. For rectal cancer, surgery is really the mainstay of treatment. In fact, for many patients who are diagnosed with early stage rectal cancer, surgery is the only treatment that they require. When patients are diagnosed with a more advanced rectal cancer, for example, one that may have spread to nearby lymph nodes, we often recommend more aggressive treatment. Most commonly, what we recommend is a course of chemotherapy and radiation, which takes course over approximately 6 weeks, and they'll take chemotherapy pills. Generally, no IV chemotherapy, which of course many patients prefer. After that 6 weeks of chemotherapy and radiation is complete, the patient is given approximately a month of rest time, and they then proceed to surgery. Oftentimes, after the surgery is complete, additional chemotherapy is administered. So for rectal cancer, the role that radiation plays is essentially to shrink the tumor before the time of surgery. Conventional radiation works by the radiation oncologist and the team who supports the radiation oncologist developing beams of radiation or X-rays. Conventionally, there were several fixed beams of radiation that are shaped so that we can treat the tumor and avoid nearby normal healthy tissues. For anal cancer, on the other hand, our goal is to cure the patient of their disease so that surgery is never necessary in their treatment course. For anal cancer, we've recently found that more sophisticated radiation techniques can be very valuable. One particular technology that we almost always employ at the Helen F. Graham Cancer Center and Research Institute for patients with anal cancer in particular is a type of radiation called IMRT. That stands for Intensity Modulated Radiation Therapy. And as opposed to conventional radiation, where there are 3 or 4 fixed beams of radiation, IMRT allows us to design 7, 9, or even more beams of radiation that are dynamically delivered. So the radiation intensity is changing as each of those fields is delivered. This is driven by very complex computer algorithms that require a whole team of people to develop these treatment plans that are very sophisticated. We have an even more sophisticated type of IMRT that is called VMAT. That stands for volumetric arc therapy. And what this allows us to do is to continuously deliver radiation from one or more 360-degree arcs where the radiation intensity is modulated dynamically throughout that arc of treatment to allow me to sculpt radiation very specifically so that I can treat the tumor and avoid the nearby tissues as best as possible. So the Helen F. Graham Cancer Center and Research Institute is an incredible place to get treatment. I think furthermore, what's so incredible about this place is that we are your neighbors. We're close by. When you come in every day for treatment, it's difficult for people to drive 45 minutes or an hour every day for 6 weeks, particularly if you're working or you have young children. We're close and we understand people who live in Delaware. We all work and live here, and we care for our patients as though they are our families and our neighbors.